to get it global so that people can get immediate support, because there's crisis. We're at crisis point. People can't get the support that they need when they're moving from crisis into therapy. There's a long, sometimes up to 2 year wait. For me, it's being able to help all those people that have maybe just hidden it and put a mask on and got on with life, and then, you know, like me, it's come to bite you back on the bum with a big bang.
Amanda.
Hiya.
Alright. Just firstly, I just want to ask you a little bit about yourself and what you do. Can you tell me what you do, please?
Okay, so I set up my own business in lockdown because I found myself in a narcissistic relationship, and I was a business developer for 14 years. So I run my own CIC and setting up lots of different businesses, social enterprises for other people, but never did it for myself. So in lockdown, I stopped what I was doing and set up my own business, and the aim of the business is to support survivors of domestic abuse to thrive in life.
Yeah, that's kind of my next question. Can you just, what actually led you to create your CIC, UKind Therapy?
Yeah, so basically, lived experience of domestic abuse. I knew that for any trauma, there's lots of therapy that are really short, and I found that people needed long-term therapy, especially when they've been in abusive situations. And so I was looking to develop something that could give people that ongoing support and therapy.
Thanks, yeah. Speaking from my experience, I had CBT over 6-7 years ago, and it was just like a 6 sessions thing, and like sign you off after 5, or sign me off after 5, and it was like just carry on with your life, and you don't really feel like I got much benefit from it, lasting benefit anyway.
And it's not very long, is it? 6 weeks. And what we found is that people need long term. You know, even you can get triggered years later, as I did. You know, my abuse happened 14 years ago, and I was triggered in lockdown as a result of that. And so you need long term support, definitely.
Yeah, thank you. Linking into that, what inspired you to focus on VR therapy as a solution for trauma?
So I'd seen that people were already using virtual reality in therapy, in health, and I wanted to see how I could apply that same theory for survivors of domestic abuse. And what I found in that journey was that therapy time could be reduced drastically from 12 weeks to 2 weeks with the immersion. So it was really that I thought, right, okay, let's see if we can put that to the software. And
well, I think it's a really good idea. I've obviously trialed it. Can you give us a little bit about how the VR therapy works, just to give people who are listening an idea?
So there was a lot of mindfulness tools that I personally used during my healing journey, and I knew that it worked really well for me. So I wanted to look at all those techniques that I personally use to put into the therapy. But I know that some therapy may not work for what worked for me, may not work for you. So I knew that I needed to go and do a bit of research around whether they do work and what works best. And so that's kind of the thing that there is different therapy, and what we've found out in the research is that it works really well for that interim period before real-time therapy, and then when it drops off, they can still have that continuum of care.
Thank you. Obviously still in the trial phase and researching, what kind of response have you had from people where you've taken this technology to? What kind of response have you had from them?
Really positive. So I kind of come away from each. So we've been working with 4 frontline services as well as yourselves, to find out if it does what it says, if it can reduce PTSD symptoms, if it can reduce return rate into crisis. So that's kind of the areas that we're looking for, but we're going to be working further with all the organisations, and it can be anything up to probably another 2 years before we're actually go to market and be thoroughly commercialised and done the full testing phase. That's going to be the big thing, when we do the clinical research. This was kind of a fact finding, but yeah, such positive feedback from all the services, which has been great.
And for people watching this, how can they actually access this VR?
At the moment they can't, because we need to make sure that it's safe for everybody to use before we can commercialise it. So that's why we're really taking it seriously on the clinical trials and the research. And we're just doing it slowly so that we can iterate the software as we go along, like we have already. We've come back to you, haven't we, and we've tested, retested the software on all the feedback and the thoughts that you already gave us. So it's kind of slow steps, but I think it needs
that.
Yeah.
I'll speak about my experience. About 3 months ago that you came in and we tested it. We gave you feedback on it, and we've used it again today, and it's improved a lot. Like the actual interface when you put your headset on, and the setting that you're in to speak with the therapist, it's a lot more welcoming. So I know we spoke about having possibly different kind of skins that you could choose, but you've not gone down that route. But it doesn't matter. I think it's much more warm kind of feeling. Being able to open the windows as well, it was really good. For me, I had a couple of when I first used it, I had an issue speaking to the therapist, and I didn't have that this time. And I tested it. I had more time to test out the VR headset today, so I spoke about one topic, and then I changed the topic halfway through and said, "Come and speak about something else." And the therapist happily spoke about something else. And then I paused, because at one point I paused, and the therapist recognised that as well and gave me more time to think. So for me, it's a positive thing. I just think maybe issues with the Wi-Fi didn't help us today. I think when you press the A button on the thing, sometimes it doesn't always respond to what you've said. I think there's a small time window to respond, so maybe that needs looking at. But like the actual, I could have sat in there for a lot longer today and spoke about issues that are going on for me. And what I did speak about, I got good feedback and good, not answers, but things that I can take away and try and action in my own life. So that's my thoughts on it. What's your aim from creating the VR therapy?
To be global, to get it global, so that people can get immediate support, because there's crisis, we're at crisis point, people can't get the support that they need. When they're moving from crisis into therapy, there's a long, sometimes up to 2 year wait. So that 2 year wait, not only does your situation change or evolve in that 2 years, somebody could be losing their life within that time period. So it's to get as many people that immediate support that they can, whenever they can.
Yeah, thank you. It's a good answer, because like you say, situations can change, and 2 years is a long time, isn't it? So to be able to possibly give someone support almost immediately, it's massive. What does your future look like for UKind? What's your dream? I know you kind of just said to go global.
Yeah, that is my ultimate dream. I mean, I'd love to be an advocate for more survivors, and my aim is to pull everybody up along the way that I can. You know, I know that how hard it was for my personal situation, and even though it was many years ago now, it came back to bite me on the bum. So for me, it's being able to help all those people that have maybe just hidden it and put a mask on and got on with life, and then, you know, like me, it's come to bite you back on the bum with a big bang. So yeah, to really help people move forward and find the purpose is my dream. And if even from the initial research, we went into a refuge, and one of the what's the cherry on the cake for me is one of the girls from the refuge who tested the software as a back-end developer. She's now in part of the team as a result, which is amazing. You know, if we can give people who need to find the purpose jobs, that's a tip
excellent.
for me.
For me, I think like coming with something like this and your lived experience, it's really important for people to. I think it'll resonate a lot more if they know that.
Yeah.
Rather than some people, it'll be coming from an angle of just monetary driven. It's not that. And I think people will see that, and it'll be important for them to see that.
Yeah.
How can listeners get involved? How can they support your work or help survivors of domestic abuse?
We've got a website, so people can go on and click the button if they want to get involved in the beta testing, because not only are we testing with 4 frontline services that we've been working with, you know, we want it to be open to anybody to access. So just get involved and join the beta testing, and we'll be in touch.
Thank you very much. And finally, if someone with trauma was listening, what would you say to them?
It's a long road, and I think you need the tools. You need to know what works for you, what makes you happy ultimately, because when you've been through trauma, you can often only see the bad things. And it's about really re-evaluating your life, thinking about what are those things that really make me happy and smile every day, and starting living from that perspective instead of oh God, I've been through this, that, you know, and kind of having that negative view to a positive one of actually I've got a roof over my head, I've got food, I'm breathing, I'm alive, do you know what I mean? And just taking that one day at a time, I think it's just small steps.
Yeah, that's very similar for us and people in recovery, doing it one day at a time.
Yeah.
Trying not to live in self-pity.
Yeah.
And just having gratitude for the things that we've got.
Yeah.
But yeah, that's everything I'd want to talk about. So thank you.
Thank you for having me, I really
Cheers.
appreciate it.